Hi, I'm Kaleigh. I'm chronically ill and disabled. I have POTS, IST, MCAS, hEDS, myofascial pain syndrome, central pain syndrome, and thoracic outlet syndrome. I'm a content creator for Vitassium, and this is my story. In March 2022, I started not feeling well. Lightheadedness, dizziness, fainting, and for about 20 months, I was a medical mystery. Now, if you know anything about POTS, you're probably thinking, oh, lightheadedness, dizziness, fainting? Of course it was POTS. If only it had been that straightforward. Of course, when I started not feeling well, I went to my primary care doctor. She said that she thought I had a virus because I had elevated platelets and elevated inflammation markers. I didn't see my first specialist until 6 months after the onset of my symptoms, and it was hematology. And my primary care doctor had sent me there because I had low iron and those elevated platelets. My hematologist said a lot of times people with low iron will have high platelets, so let's bring that iron up and see if your platelets come down. So I had a series of iron infusions. She didn't have anything to say about my symptoms. Of course, bringing my iron up really didn't help much, not even my fatigue. So then I was sent off to rheumatology. My first and only appointment with this rheumatologist was the very first time I had been gaslit so deeply that I left crying. He was in the room for probably 5 minutes, and he spent 3 out of those 5 minutes telling me that I'm fat, I need to lose weight, and I'm just anxious. Of course, I was crushed. After that, of course, still with no answers, still continuing to get worse and experiencing more and more symptoms, the specialist train continued and I was sent to GI. I'd started having a lot of stomach pain, almost constant 24/7 nausea, diarrhea, so it made sense to see GI. I had a colonoscopy and endoscopy, and they both, for the most part, were normal. That brings us into 2023. In February, I saw an allergist. We did all of the normal, skin allergy tests. I found out that I'm allergic to cats. Who would have thought that? Not me. Genuinely, I said in the appointment, well, I know one thing's for sure, I'm not allergic to cats. And I scored a 3 out of 4 on the allergy scale. So thanks, Mimi. Now, another important finding my allergist discovered was that my chromogranin A was 3 times the normal amount. And obviously, I didn't have a specialist to look further into that, so we kind of just set it aside. But it will be important, and it'll come up shortly. 2 weeks after seeing the allergist, February 14th, 2023, I saw my first neurologist. He failed me. I went into this appointment planning to ask about POTS, hoping that I would be walking out of that appointment with an order for a tilt table test, full autonomic testing, something. So of course I told him my whole story. I told him about the symptoms, the specialist I'd seen, all the dead ends. I asked about POTS, so he did orthostatic vitals. My orthostatic vitals came back normal. What he missed was that I was on 80 milligrams of propranolol, a significant dose of propranolol, which is, say it with me, a beta blocker. And of course, beta blockers are very often first-line treatment for treating tachycardia and POTS. So of course my orthostatic vitals were normal. And that appointment sent me back a lot because at that point I said, okay, well, we've ruled out POTS. I didn't know better. And it was at that point in March 2023, I decided I'd had enough. I'd seen enough specialists with no answers. I needed to go elsewhere for care. I applied to be a patient at Mayo Clinic. They were not accepting patients at the time. So then I applied to be a patient at Cleveland Clinic and I was accepted. At the beginning of March, I was able to see an internist at Cleveland Clinic. My appointment was super thorough, over an hour. Of course, I told him my whole story. He decided that I needed to see endocrinology, gastroenterology, rheumatology, and hematology. And he seemed pretty certain that my symptoms were actually carcinoid syndrome being caused by a neuroendocrine tumor. And it wasn't just my symptoms, I think, that convinced him. It was also my chromogranin A being very elevated. So I waited March till June, and then in June, I went to Cleveland Clinic and I saw those 4 specialists. I had so much testing and imaging done at Cleveland Clinic, and even then, they missed all of my diagnoses. And that was especially hard for me because when I went there, I was thinking, I'm almost done. I'm almost done being a medical mystery. This is it. And obviously that was wishful thinking, and I was pretty naive to think that, and it didn't end up being the case. But like I said, Cleveland Clinic was very thorough. Now remember, 2 times now I've mentioned my chromogranin A. Since my chromogranin A had been at least 3 times the normal amount in February, they wanted to test it. This time in June, my chromogranin A was 5 times the normal amount. So of course that, in addition to my symptoms and my kind of weird and slightly off labs, I made a pretty convincing case for a neuroendocrine tumor, so they ordered a full body day-to-day PET scan. So I returned a month later in July 2023 to Cleveland Clinic to have my full body PET scan, and it came back clear. So at that point, they were stumped. I was stumped. I had no idea what to do next. None of my specialists were guiding me or pointing me in any direction at all. So then I figured, well, I seem to have a lot of tachycardia and a lot of heart palpitations. I guess I'll just see cardiology next. And that ended up being the right move and getting me closer to my dysautonomia diagnoses. He immediately ordered a 14-day Holter monitor, and that revealed that I had an abnormally high resting heart rate, and I didn't know what it at the time, but that would later on support my IST diagnosis. Now, I started posting on TikTok a couple of months before I first went to Cleveland Clinic, so the spring of 2023. And the reason I bring this up is because people who I met on TikTok changed my life. So first, one of the friends I made on TikTok, we both lived in Chicago, so we decided to grab coffee. She was the one to tell me, wait, you're on propranolol? Propranolol is a beta blocker that's often used to treat POTS. And the light bulb went off in my head. No way. If we hadn't gotten coffee, if she hadn't said that, who knows how long it would have taken for me to realize that that was affecting test results. Now, it was another friend I'd made on TikTok that texted me one day in early fall, I think beginning of October, and she said there's this neurologist moving from one hospital to the other near you. She's not going to have a wait time. She treats and diagnoses dysautonomia. You need to call and get on her schedule while there's no wait list. So I called into just that, and I was able to get in and see this neurologist within 2 weeks of calling. And this was the doctor that changed things for me, that actually made things happen, who is now like the center of my care team. And this appointment was the first time a doctor looked me in the face and said, there is something wrong with you. We are going to figure it out. So then she sent me for full autonomic testing, and I think the universe was looking out for me with that one too, because from the time of calling to going to get my testing done, it was like a week and a half. And of course, that's what diagnosed me with POTS and confirmed the IST. Now, at the same time this doctor referred me for testing, she also referred me to a physical therapist. She also referred me to an allergist. She also referred me to a pain management doctor. And all of these providers are still part of my care team and are significant contributors to my care and treatment plan, even now, more than a year and a half later. I've been in physical therapy for just about 20 months now. There isn't an end in sight, but I do really enjoy it. And like I mentioned before, when my neurologist referred me to pain management, that's where I was diagnosed with central pain syndrome, myofascial pain syndrome, and thoracic outlet syndrome. When all of this was happening, I also went to see my allergist. I was a very busy girl in November and December of 2023, and that's when I was diagnosed with MCAS, mast cell activation syndrome, and started treatment for that. So then with all of these diagnoses, when I returned to my neurologist in 2024 in February for a follow-up, that's when she diagnosed me with hypermobile Ehlers-Danlos syndrome. And now it's July 2025, so the rest of 2024 and all of 2025 so far, we have spent trying to figure out my GI problems. I've now seen 3 GI doctors. I've had extensive GI testing, and it's been such a frustrating process because there's been so many times things have come back abnormal, but it's not abnormal enough to point towards something really specific, which of course is so frustrating. But it feels like we finally made some progress. Just last month, I had surgery to see if I have endometriosis because I had pelvic MRI findings that indicated I might. They did not find endometriosis, but what they did find was chronic inflammation throughout my whole pelvis. They also found that my omentum, which is kind of the layer of fat that covers your intestines, was stuck to my abdominal wall with adhesions. And we're not sure if the adhesions were causing my stomach pain, and now that they're released, I hopefully won't have these really awful stomach pain episodes that feel like gallbladder attacks. But it does make a lot of sense if that's the case, especially because my GI doctor thinks that I have visceral hypersensitivity of the nerves in my GI tract. That's my story up until this point and kind of what I'm dealing with right now. It's been more than 3 years and I still don't have all of the answers. I'm disabled by my illnesses and my health continues to decline even as I do every single thing my doctors ask of me. So if that sounds like you and you're going through that or something similar, just know that you are not alone in what you're going through. This journey, navigating the medical system, navigating the diagnostic process can be so isolating, but you are not alone. You are not making it up. Your reality is not up for debate. We get so much information thrown at us and it can feel impossible at times to keep it all straight while also trying these different treatments, trying to manage our symptoms. We're doing all of this extra labor, going all over to different tests, appointments, procedures, trying to feel better. And in all of this, if we find something that helps us manage our symptoms, we feel like we have to hold on for dear life. For me, one of the main things I use to help manage my symptoms and that I'm holding on to for dear life are my Vitassium fast chews. I use Vitassium's electrolyte fast chews on a daily basis, and that's why it's so special for me to be able to make content for them. Many of us on the Vitassium team have dysautonomia or love someone with dysautonomia. Vitassium products are made by and for folks with chronic illnesses. If this sounds like you, consider signing up for our Vitassium Club, our free program that provides discounted products and free shipping on select orders to anyone who uses our products to manage their illness. You can save up to 25% on every order by signing up for our Vitassium Club at vitassium.com.